Intellectual disability, or intellectual developmental disorder, is a disorder, with onset during the developmental period, that includes both intellectual and adaptive functioning deficits, in conceptual, social, and practical domains. The following three criteria must be met.
A. Presence of deficits in intellectual functions such as reasoning, problem-solving, planning, abstract thinking, judgment, academic learning, and learning from experience, confirmed by both clinical assessment and individualized, standardized intelligence testing.
Criterion B. Deficits in adaptive functioning, that result in failure to meet developmental and socio-cultural standards, for personal independence and social responsibility. Without ongoing support, the adaptive deficits limit functioning, in one or more activities of daily life, such as communication, social participation, and in independent living. Adaptive functioning deficits are seen across multiple environments, such as home, school, work, and community. Criterion C. Onset of intellectual and adaptive deficits occurs during the developmental period. The third criterion stipulates that the onset of the deficits occurs in the developmental period. It is not uncommon for children to develop multiple, often co-occurring impairments. In many cases, parents or doctors notice that the child is behind his or her peers in the development of language, academic skills, perceiving peer social cues, dressing, or elimination. The child level of development is then compared to the expectations for that particular developmental stage. Children often require a broad assessment of functioning. Intellectual disability has an overall general population prevalence of approximately 1%, and prevalence rates vary by age. Prevalence for severe intellectual disability is approximately 6 per 1,000.
When the three diagnostic criteria are met, you should specify current severity. The various levels of severity are defined on the basis of adaptive functioning, in conceptual, social, and practical domains. IQ scores are not used because the low-range IQ scores are less valid. In addition, the severity is determined primarily to identify the level of supports the child needs. The diagnosis of intellectual disability is based on both clinical assessment and standardized testing of intellectual and adaptive functions. The deficits in general mental abilities, criterion A, that are assessed include reasoning, problem-solving, planning, abstract thinking, judgment, learning from instruction and experience, and practical understanding. Critical components include verbal comprehension, working memory, perceptual reasoning, quantitative reasoning, abstract thought, and cognitive efficacy. Intellectual functioning is typically measured with individually administered and psychometrically valid, comprehensive, culturally appropriate, psychometrically sound tests of intelligence. The impairment in everyday adaptive functioning, criterion B, requires assessment of how well a person meets community standards of personal independence and social responsibility, in comparison to others of similar age and socio-cultural background. Adaptive functioning involves adaptive reasoning in three domains: conceptual, social, and practical. The conceptual, academic, domain involves competence in memory, language, reading, writing, math reasoning, acquisition of practical knowledge, problem solving, and judgment in novel situations, among others. The social domain involves awareness of others' thoughts, feelings, and experiences, empathy, interpersonal communication skills, friendship abilities, and social judgment, among others. The practical domain involves learning and self-management across life settings, including personal care, job responsibilities, money management, recreation, self-management of behavior, and school and work task organization, among others. Intellectual capacity, education, motivation, socialization, personality features, vocational opportunity, cultural experience, and coexisting general medical conditions or mental disorders influence adaptive functioning. Criterion B is met when at least one domain of adaptive functioning, conceptual, social, or practical, is sufficiently impaired that ongoing support is needed in order for the person to perform adequately in one or more life settings, at school, at work, at home, or in the community. To meet diagnostic criteria for intellectual disability, the deficits in adaptive functioning must be directly related to the intellectual impairments described in criterion A. For criterion C, the onset must occur during the developmental period, meaning that intellectual and adaptive deficits are present during childhood or adolescence. Sometimes, children can have a medical problem, and it's difficult to assess intellect. Maybe they have a speech issue, maybe they communicate via computers. So we can't necessarily say that their intellect is different, or is delayed or deficient. When we don't know that for sure, sometimes we will use that global developmental delay title, if there is a suspicion, or we want to check this later, when they are older, to see if there is a delay there. The diagnosis of global developmental delay is used for children under the age of 5 years, when the clinical severity level cannot be reliably assessed during early childhood. This category is diagnosed when a child fails to meet expected developmental milestones in several areas of intellectual functioning, and applies to children who are unable to undergo systematic assessments of intellectual functioning, including children who are too young to participate in standardized testing. This category requires reassessment after a period of time. This category of unspecified intellectual disability is reserved for individuals over the age of 5 years, in cases when assessment of the degree of intellectual disability is difficult or impossible. For example, it can happen because of blindness or prelingual deafness, locomotor disability, or presence of severe problem behaviors, or co-occurring mental disorder. This category should only be used in exceptional circumstances and requires reassessment after a period of time.